This is NDTV. And you're watching NDTV Hindu.
Hello again. Over the recent years, there's been so much increased sporting activity in our country. Football, hockey, cricket, volleyball, basketball, tennis, squash, just to name a few. And every single sports person who indulges in any form of sport, whether it's professional or amateur, finally does need the help of a sports medicine doctor. And to this end, we decided that we'd kind of take a look at sports medicine as it exists in India today. My guest today is Dr. Kannan Pugazhendi. Now he's a sports medicine specialist and he has 5 clinics, 3 here in Chennai city, 1 in Bangalore and 1 in Coimbatore. And so we're going to catch up with him and try to find out what this is all about. Thank you so much, Dr. Kannan, for being with us today. Now, let's first of all talk broadly about what sports medicine actually entails. What's the gamut that it covers?
As normally people feel, sports medicine is not just about sports injury management. It talks a lot about how the healthy population is kept healthy. In other words, you do not reach a hospital prematurely, and that is why a sports medicine center should function. But the limelight of that sports medicine comes from the sporting injuries, because that is what we see very often publicized.
And we read and hear about that all the time.
But when it comes to sports medicine, we are not treating illness so much, but we are trying to maintain the wellness of the people. But we do deal with the what we call as morbidity. That is to say, there are injuries which need corrections, which require assistance so that they can return back to their normal life with the best of their potentials.
Right. But would you actually look at sports persons, not when they are injured or in anything like that, do they actually have to come in to see you when, you know, just to keep fit and just to sort of keep themselves going, keep themselves in peak condition?
Perfect. I do that. In the sense that the players who reach out to me are into prehabilitation. That is to say, they want to prevent injuries and they need to know how their body could lead on to injuries because of their structure or because of a specific function that they repeatedly do. For example, a tennis serve or a basketball or set shots. So many things that they do specifically, they may require assistance before they get injured. So a sports medicine doctor is a requirement for them in assessing them, what we call as pre-participation assessment.
Right. What's the difference then between a sports clinic and a regular gym? Is there a difference?
Sports medicine center does not have the idea of getting everybody into a center and get them to exercise.
Okay.
But we do have patients who want to come back to be normal, exercising as much as the others, and would like to reach a certain level of fitness for them to appreciate themselves more. And say, for example, some of them would like to go to the Himalayan base camp. In those kind of conditions, that they want to know, can I go for this Everest base camp? Climb. And so they come to me with these kind of ideas and dreams. I encourage them to ensure that we reach that kind of a potential and they will not be in any problem when they reach that base. In fact, there were people who are going to Kilimanjaro, a very important space in Africa, and the whole team had landed and we had trained them, and all of them except the person who didn't train reached the top of the mountain, right, to be very specific.
Okay. Well, Dr. Kannan, you look in amazingly good shape. I mean, you look like you'd get to the Everest, to the peak of Everest tomorrow if we let you go. but you have a lot of very well-known people who actually come in here. I don't know if it would be confidential for you to tell me who those people are.
I have the Indian team football captain, Baichung. Baichung Bhutia, a very good player of very good repute, and very few Indians have reached his caliber. I do see him here for his fitness, for his assessments, as well as injury management. And we are assisting him in his new academy that's being happening in Sikkim, which he's starting. At the same time, I have the Indian basketball team captain, who is Mr. Robinson, and we train with him also. And we do have cine stars who come in for support. We have had Surya, or we have had various like Vishal and Mr. Arya, because they come in a shoot that they are injured and they have to continue to shoot.
Okay.
And they are also requiring a specific amount of fitness to be able to do what they are expected to do.
Yes, we understand also that our national chess champion Vishwanathan Anand also comes in here.
Yeah.
Now what would he come in here for? Is it to keep him mentally fit? How is
I
that?
never enter into that aspect of Mr. Vishwanathan Anand, because he is so good at it that he doesn't require amazing.
Right.
But what we require, what he requires as support would be his fitness, wherein he doesn't find the time to give for fitness. So we have to understand his requirement and the time available, and prescribe the exercises such that he will be able to get the best of it, and still not be having a back pain or a knee pain, which a person of his caliber should not have.
Right. Is it necessary for all of these celebrities whom you have on your rolls to be coming in here? Do you ever need to go to them?
It depends. Certain times I do see them in their environment. For example, a football player, I may have to see in his environment for his requirement. So I may go, but otherwise I prefer them in my place, where I can assist them with whatever gadgets that I have. And with my team of nutritionists, physiotherapists, trainers, I would be able to assist them better.
Right. But talking about gadgets, you just took me around your place here. I didn't see a great deal of gadgets. I'm just wondering, where does this happen? Is there an area I haven't seen in here?
There's a major misconception that there must be a lot of gadgets to treat people. In my 25 years of practice, I have not invested on any form of gadgets that could heal people.
There's nothing expensive or flashy right here.
There's a normal ultrasound and IFT, which are not very costly equipments. We do use one is called as the pulsetron, which is a magnetotherapy unit. That's the maximum I've invested. But most of our work comes from our hands. We use what is called as a myofascial trigger points.
Tell me that again, Doctor.
Myofascial trigger points.
Right.
These myofascial triggers happen in the body whenever muscle is used beyond its capacity, stretched beyond its capacity, or overworked. And this is what commonly people do in a sporting arena, or even people who work in a kitchen to reach out for a vessel or something above their head. They may stretch their muscle beyond their capacity and have a myofascial trigger. This myofascial trigger was introduced to the world specifically by Dranna Travel, who was the physician for John F. Kennedy when he was running the president.
He always had a very bad back, right?
Sure. And this guy couldn't sort of stand until Dranna Travel came into the picture and made sure that he could go through his presidential election scenario, and made sure that he was in the best of his.
Right. And of course she ended up after that becoming the White House physician for many presidents, right, Doctor?
Yeah. And she was able to give a book which was the major book even today. That's the Bible for myofascial trigger.
Right. I'm going to ask you to hold on for just a short while. We'll take a very short break, but when we come back, we'll go into some other aspects that relate to sports medicine. Don't go anywhere. We'll be right back with you. Welcome back to our program. You've joined us here on We Connect as we're chatting with Dr. Kannan Pugazhendi. He's a sports medicine specialist. Thank you so much, Doctor, once again for staying with us. Is sports medicine popular in India?
It is now popular in India because people hear the word sports as a career. Until then, it is not possible for sports medicine to be a specialization.
So how did you become a sports medicine specialist then? Why did you become, really?
It was my passion to be a sportsman. I wanted to represent our country. I saw Jesse Owens' 1936 Berlin Olympics, that is say the return of Jesse to Berlin. So I was so motivated to run. So I was running regularly. But unfortunately, when I entered the medical college, it was not possible to pursue.
Time.
It's not possible with a 7 o'clock OP and
Yes.
till 8 o'clock we work late. But I continued to have my passion for sport, and I was obsessed with medicine once I entered the college. So mixing a passion and obsession was the best thing that could happen.
Right. So this was the next best step for you, right? So you're very much right there in the middle of all the action, right? Do you see a future for sports medicine, having said what you've just said to me?
We are still not started any work on sports medicine because the medical colleges have to recognize sports medicine as a subject or as a curriculum. We don't have specialists in our country yet. Those who have completed sports medicine are very, very, very few.
Really?
No.
Why do you think it is
Who's
not
going to pay
popular?
them?
Ah, okay.
Where is the
it's
money
not
gonna
it's not a
come
good
from?
money-making thing for a doctor.
Basically, where any profession, we need to have the money to continue to do it. But when I started off, I was located at the YMCA College of Physical Education, where I was taking up the sports school where children didn't have support of any kind of injury that they had. I used to take them to the medical college and bring them back.
Okay.
And they said they had put a cast for a sprain. I had the best of the orthopedicians see them. But when they came back the next day, they cut open the cast, tie a crepe bandage, and they were running. So I realized what they wanted and what we are doing is not
Doesn't match up
at
really.
all. So I started learning more about sports medicine. And this coach who was sitting down there by name Mr. Ravanan asked me to see any injury in the sporting arena. He said, you fix it. So I had no other go. I have to find some way to fix something like this where I didn't have experience. By 84 when I joined, and by around 87 I knew what to do. And by 89 I was with the Indian cricket team, accompanying them for the West Indies tour. And I had the best of the opportunity to learn what was happening at that level of competition. And following that, it was at the 1996 Atlanta Olympics, I met the best of the guy whom I should say India should use as a coach for hockey. And that is Cedric de Souza. And this was a man who taught me how to love country. There's nobody, I think, who is well versed in hockey as much as him, and the passion for sport, the love he had for his players, phenomenal.
Right. But now you're saying that there are not too many sports medicine specialists in India. I do know that at the recently held Commonwealth Games, there were 325 doctors and not a single sports medicine specialist. How in the world could you conduct an international sporting event like that without a sports medicine specialist? Is this correct information that we have?
Definitely there were no sports medicine doctors that are made available.
Isn't that a disgrace?
Definitely. There's no doubt about it, because even when we had this Commonwealth, the SAF games here, at that time they wanted to know how we could manage it. So the then government had called me to find out how we can run programs for a short while to prepare the doctors for this event. So just placing a cardiologist or an orthopedic surgeon would not do the trick. We have to have sports medicine people trained for that particular activity, taking up this. Unfortunately, in our country, we don't give importance to sport, and we don't give importance to sportsmen and women who give their blood and sweat for the honor of the country.
That's true.
So it's a major disgrace when we find that we don't take care of them. Their security is threatened. When they are injured, where do they go? So they don't actually give out their best, perhaps.
Right. And then, of course, we crib that we have 1 billion people and we have no champions. We're not encouraging really champions to be bred here in our country in that respect. You have 25 years of experience. Now you tell me, are you training any other young people to, to do what you are doing?
Actually, sports medicine is about a team of people. It is not about an individual.
Oh, really? Okay.
So sports medicine is one specialty which needs exercise physiologists, which needs biomechanists, which needs sports nutritionists, sports psychologists, sports biochemistry, sports pharmacology. So it requires a lot of people getting involved with it. Abroad, this is a major thing happening. In our country, there are very, very few people involved in sports itself. Today, the IPL has gathered so much of attention, and people want to be there because of the important things that can happen through it, money especially.
Yeah.
But still, the capacity of the individuals who can take care of the injuries is not as good as we could have preferred. It is not an impossibility. We need to train not only the physiotherapists, the trainers, the nutritionists, but we need to train our physicians. And sports medicine is not an orthopedic specialization. It is sports medicine and not sports surgery. But the surgeon comes in as the major decision factor where there are fractures and arthroscopic surgeries involved.
Right. Now, in your particular field, you must have to work a lot with an orthopedic surgeon. Do you find that that's an essential part of your team, or isn't it an integral part of what you're doing?
Actually, I don't work with an orthopedic surgeon. When there is a fracture, I refer the case to the surgeon, or when there is an arthroscopic surgery required, and when my rehabilitation has failed, I refer it to an orthopedic surgeon. With the anterior cruciate ligament, I am there with 20 years, and I play basketball and I do my martial art kalari pipe. And similarly, I have put the guys into rugby, playing 3 years of nationals with the anterior cruciate tear, which is not acceptable in an orthopedic standards, but in sports medicine, it's very much possible.
Right. We're going to come back after a break and ask you what you yourself do to keep as fit as you look. Time for us to go. We'll just be away for a very short while and get right back with you here on Reconnect. Welcome back to our program, continuing that discussion that we're having right here about sports medicine and what this means, what it's all about. What about normal people? What about people who are not celebs and not sports persons and not champions? Would they need the services or, the expertise of a sports medicine specialist like yourself?
The best example is one Mr. Sudarshan, who had a cardiac transplant, who had it in 95. I met him in 96, 97, and he was going for the transplant games. So as far as this guy is concerned, he has never run in his lifetime, and his heart rate never goes above 35, 40.
Really?
So we made him go for this competition, and this is the one end of a spectrum where people who are really gone through the worst phase and brought back by a surgical procedure, and the heart is transplanted and they can participate and run. The other side is very old people who are around 85, 86, Mr. John Devas is running even today for his 100, 200 long jump, triple jump, high jump. Amazing. And this guy is amazing. Yes. And these kind of people participating in sport require support, those ones. But what you are asking me is general population requiring a knee replacement. I avoid a knee replacement by getting them into the water and aqua therapy.
Right, this is one of the other things that you promote in a very big way. So tell me about your aqua therapy. I know that you kind of promote it a lot. Do you believe that this is one of the most effective ways that a sports medicine specialist like yourself actually achieves success?
Definitely. I find that if we can avoid a surgery for any part of the body, anyone would prefer that.
You're a doctor first?
I'm a doctor first. There's no doubt about that. But I would prefer to ensure that my patient heals without any form of a surgical intervention until unless it is an absolute necessity. We must avoid. And that's a major requirement for patients who are afraid of a surgery, who is happy about a surgery, whether it's a keyhole surgery or not. So I take them through aqua therapy where their weightlessness, that is say 90% weightless in the water. So the joint rejuvenates, and we find even the deformed state of the joint recovers to such an extent. Patients who are not able to walk are walking, and their gait, they were shifting from one side to the other. Now they are progressing forward. Right. And those kind of changes have happened not in years' time, in a month's time.
Really?
That's in a month's time.
That's quite incredible what you're saying here. Now, one of the other things you do, Dr. Kannan, is actually work with special children who have special needs. Let's talk a little bit about that. Your role, I mean, as a sports medicine
specialist. Sports medicine is again focused for the healthy population. We do not have enough importance given to a group of people who have real needs. And these children become obese, get diabetes, hypertension, and these diseases of inactivity are going to be affecting the population that we said in a big way, because everyone is bothered about taking care of them in terms of clothing them or feeding them, and they are overfeeding them and very minimal activity. So today there is awareness for helping them, but helping them also to maintain their health isn't there. So a health related fitness component is essential here, and we assist them, and moreover when they participate in any form of a physical activity, we find their capacity is improved, their self-respect, their capacity to do what they were not able to do is far higher than what we could have expected.
This must be one of the satisfying things of what you do. It really must be a challenge.
Yes. I enjoy doing that, because we find people who were not given an opportunity to be with the other people around them are given an importance to actualize what they are capable of doing, and that's definitely possible. Similarly, I work with the dancers and martial artists, because dancers are another group who also come under sports medicine, never given any importance, because the dance injuries in our country is not given that much
there's not much focus on dance injury. Yes.
The reason is that there was only one article written by me on Indian dance injuries. That means there is nobody who is dealing with dancers in a country of this size, and dancers who are involved in Bharatanatyam, Kuchipudi, Mohiniyattam and various indigenous forms. We have never even understood how injuries can happen. And
yes, how can they happen? To a dancer, I mean, good.
The reason is they never warm up, they never warm down, and there is never a stretching program, never a strengthening program. And the Odissi and Bharatanatyam have enough banging of feet and twisting of the spine, and they have never prepared their body to achieve what the choreography demands. So that is another area where I feel India could do a lot more for our dancers through sports medicine.
Right.
We assess and we train and we ensure that their rehab is done so well that they can return back to dance without a problem.
Right. You've been working at the YMCA for many years now. Tell me right at this point of time as we sit here speaking, what is it that you're actually doing there? Are you doing there what you started to do there many years ago?
I still enjoy working there, because I thought this was a sports medicine center when I saw a board, and I realized that was only a board and nothing beyond it.
Right.
That's why I joined the Y. But I realized later that I could create one, and after doing beyond a point, I felt that the growth is limited out there, and that's why I had to create my private centers where the growth is possible. But still, being my parent institution where I started my work, I have not neglected it. I still give my time for them and ensure that the people who still can't afford to see me anywhere could still see me there. And I help the police commandos, police academy, where I was able to design their training program after the 1968 manual. I help them, they come back to me for injuries. So those people can't afford to pay, they are treated still there. And the injuries that happen there at the Y, when there's competition, are still managed at that place. I still manage the injuries. I take lectures, but I treat all my private patients outside.
Right. But do you, on a personal level, get more satisfaction when you go out, you know, into the open and you're actually working with people who are performing, either they're dancers or they're athletes or they're sports persons of any kind? Is that for Dr. Kannan something that really excites you?
Otherwise I won't be living.
Oh, that's cool. That's a good answer.
The reason is that that's what allured me to sports medicine, that I'll be traveling, meeting people and helping to the best capacity of mine the people who require that assistance. So I had to gather so much around, and what I have today, because I didn't have a teacher, that is the reason that I was able to gather.
Right. Well, Dr. Kannan, we don't have any more time left to continue this very interesting discussion, but please continue to live, please continue to enjoy what you're doing. You obviously have a passion for it. I'd like to thank you very much, sir, for being with us today.
I really appreciate it.
Well, that's all we have time for here on We Connect. But you don't forget to join us every weekend, Friday nights at 9:30. We'll be right back with you. Remember that this is the program where you'll find people who are very interesting, people who really have something to tell us, people whom it's a pleasure to listen to. So until the next time, you take care. Bye for now.